It's hard to imagine that about 6 months ago we were standing right at the middle of the Yuba City Fairgrounds here at the Arts Building. The fair in the summer, busy, hundreds of people around. Well, today there are hundreds of people around for another reason. Today they're here for the blood drive. And you're Mr. Harold Graham, is that right, sir? Very nice meeting you.
I do.
Are you here to donate blood today?
Yes, I am.
Have you ever done it before?
Yes, quite a few times.
How many times have you been here?
Well, here specifically, 44 donations.
44 times.
This particular blood bank. Before that, I was in San Jose and I donated to the Red Cross down there. So at this point, I have a little over 7 gallons to my credit.
I wonder how many lives you've saved with that blood. Any idea? It's hard to tell.
No idea, but I don't worry about that. I just know that it's helping someone, and that's really all I worry about.
Extremely commendable. What I would like to do, sir, since I haven't been to one of these in our town, I'd like you to show us what you actually have to go through when you come here to donate blood. So what's the first thing that happens when you enter the door here today?
Well, the first thing you do is you come here to this pre-registration.
Well, why don't we let you go through that, and I'll step aside, and you can just proceed.
Okay.
Would like to fill out your application if you
yes.
donate blood today. And if you have a donor's card, I would like to see
There it is.
that.
Thank you.
All right, would you like to read this?
Okay.
And then we will fill this. This is additional information that we must have you read.
Okay.
And then I will take this and I will fill in your name, address, and the number of donations. You've given blood before at the blood bank?
Yes, ma'am.
All right, then I shall take your blood type and your number of donations. If you'd like to read this over, I'll start filling this in first.
I've read this before.
You have?
Yes.
Well, it's much the same as it usually is.
How are you, Mr. Graham?
I'm fine.
How has your health been?
It's been very good.
Good. May I take your blood pressure?
Yes, ma'am.
We'd like to see if you have a normal blood pressure and within our limits, and give you a little bit of a mini physical.
Okay.
Questions about your general physical health, and would you please give me a yes or no answer?
Okay.
Okay? If it's no, we'll talk about it.
How are you doing today, sir?
Fine.
I'm going to take your temperature here.
Okay.
I'm going to check to see if you have enough red cells in your blood also. I need to see your left hand, please. These fingers down right like this, and put your thumb across those fingers. Drop a sample inside the copper sulfate. See if you sink directly to the bottom. There you go. Put on that with your thumb. Your temperature is 97.2. I'll take the thermometer back. I'm going to stamp your card here for your calories. Thank you, sir. Hold on to this little tag. You're ready to go right on into an empty bed.
Okay.
Well, it appears, Mr. Graham, you've passed all the tests and are about ready to take the blood. It's been sort of a painless process so far, hasn't it?
Yes, it's been quite painless. This particular thing used to be a painful situation because they stuck a little metal
Lancet?
You know, yeah.
Right.
But now they have a little mechanism that's much easier on the finger, and it doesn't make me jump near as much as I used to.
Great.
Hi, you're Mr. Graham?
That's right.
Here, you want to have a bed right here?
Okay.
Okay, comfortable?
Mm-hmm.
Great. Okay, I'm just going to put the cuff on you here. I'd like you to hold on to that, and I'm just going to check your veins first of all.
Okay.
And just put some pressure on the cuff here. And I'd like you to squeeze. Okay, you got that.
You find a good one there?
Yeah, you got a good one there.
Okay.
Okay, relax your hand, and I'm going to scrub your arm up.
All right.
Okay, this is just a cleansing scrub I'm going to do on your arm here. Relax your hand. How does that feel now? Is it okay?
Feels fine. Once in a while, you get a little burning sensation, around the needle. But as far as pain, there's really no pain to it.
Well, that burning sensation is from, there's a solution in the tubing, an anticoagulant to keep it from clotting, and sometimes that does get out on the needle, and that does sting when it is under the skin. But it's usually very temporary.
Yeah, right. Feeling okay?
It's feeling beautifully. I'm going to be taking some samples for our lab. We use this to test for many diseases and to make sure that nothing is transmitted by the blood.
Well, Mr. Graham, you've just given the gift of life. How does it feel?
Feels great. There's really no feeling at all.
And then for your reward today, besides the personal satisfaction, they gave you this nice eclair donut.
Right, the donut, juice, and then coffee. That's really what I come over here for, for all the goodies afterwards.
Well, there's really some purpose to having you drink this and eat this. Do you realize what that's all? What is it for?
Well, the more you need liquids in your body after you've donated blood, it helps to start the blood rejuvenating.
And the calories, too, it makes you sort of feel more alert.
Yeah, it gives you, a little pickup.
Are you required to stay here and rest for a few minutes after the blood is taken?
I believe they require, they ask you to stay for a few minutes,
10 minutes
and rest.
or so.
And
We've now had the chance to see how someone has blood taken from them when they're donating blood to the Sacramento Blood Center. What we'd like to learn now is what happens to the blood after the patient donates it. What tests are done? What goes on to determine what's in that blood? With me today here at the Rideout Hospital Laboratory is Mr. David Ullman, one of the very well-trained laboratory technologists here at Rideout. Mr. Ullman, what happens to blood after it's taken at a blood drive?
Okay, the process after blood is taken is it goes to the blood bank, and there they determine the type, which is the group and then the subgroup, R or RH. And once that's determined, then they do what's called a serological test to make sure that the blood is negative for syphilis. They do a screening for hepatitis, and those are the two serological tests they do on the blood.
It's my understanding they're soon going to be doing different viral tests for AIDS, too. That's coming up. Maybe not available yet, but coming up.
That'll be in the future, right. Right now, basically, what they do is just the
hepatitis and the syphilis.
Right.
What has always confused me and a lot of people is what is actually meant by a blood type? What makes one blood type different than another blood type?
Okay. Now, basically, you can go back in and talk about the genetics, but just basically what it is there's little, what's called tags on the surface of the red cell, and what it is okay, now like we have here, we have O, A, and B. Okay, now the O is the absence of any particles on the red cell. A, then you go to the A group, and then there'll be a particle for the A. And what happens is when you type the blood, you'll add what's called an antiserum. And if the patient's A, then the blood will group. Then you do the same thing for B.
So someone that has A-type blood would have a particle that's called type A particle.
Yeah, basically what it would
Someone
be.
that has type B would have a B-type particle.
Right.
And someone that has type O would have none of those
nothing on it, right.
particles.
There would be nothing on the red cell.
So if somebody then takes type A and gives it by mistake, which doesn't happen anymore because of this
Right.
testing, to someone
Right.
who's type B, they'd have a reaction which could be very
Yeah,
dangerous.
theoretically that's what could happen. And then what happens, you get clumping and then the kidneys will shut down.
Which we don't want to have happen.
Right.
I know when I was working in internal medicine, it was always a very strict process when someone would have their blood typed and cross-matched.
Right.
The technologist was never allowed to be interfered with. It always had to be done in a precise way.
Right.
Could you show us what's done to type
Sure.
blood?
I'll take a unit of A pos. Okay, now theoretically, we wouldn't know what this was.
Right.
Let's say that we just had a donor and we took this unit and we're going to now we're going to find out what the type in RH is. Basically what we'll do is we'll divide the slide into two parts. We'll take some scissors, and these are called tails on the unit. We'll cut this off, and then we will, let's see, we wouldn't put that on the countertop. Then we'll take a drop of blood. Now then we'll take the appropriate reagents and without contaminating them. And by the way, all the reagents now are color-coded. One is for A and one is for B. Okay, now then we'll mix reagents together. And then we will rock it back and forth. And now you can see the clumping on the A side, and the B side is negative.
So what happened is the A anti-serum caused this clumping, which is positive for A. Is that correct?
Correct.
So we know that that type blood is type A.
Right.
Now you can also test for other types of things besides just A. There's RH factors and other factors as well. But our special guest tonight comes to us from the Sacramento Blood Center. Dr. Leonor Fernando serves as senior staff physician at the Blood Center. Dr. Fernando, welcome to the Medical Explorer, and thank you for joining us this evening.
My pleasure.
I'd like to begin, and I always like to begin, by having our viewers learn a little about my guest's educational background and training. Could you tell us about yours?
Sure. I am an internist by training. I originally trained in my own country, Colombia, in South America. And I came to New York in 1970, where I trained in hematology.
Hematology, we should let our viewers know, is the study of diseases of the blood.
That's right, yeah. And cancer of the blood, too,
Okay,
as well.
right, of course.
And I work subsequently in Seattle, Washington, at the University of Washington with bone marrow transplants.
Bone marrow transplantation. I've heard of people from this area actually going there for bone marrow transplantation.
That's right. Some of them were probably my patients.
Oh, really? Oh, that's interesting. And how did you get actually to the blood center?
Well, when we moved to Sacramento, I decided the best way to use my experience with transfusion medicine that I have acquired in Seattle was to contact the local blood center. So the medical director happened to be looking for an assistant at that time.
Excellent.
So I've been there since. It's almost 10 years now.
10 years. Gosh, you don't look old enough to have been there that long.
Well,
What can I say? So your involvement in the blood center came about from that contact with the director, and that's how you got into that, basically. Is that right?
yes. New programs were being created, and he really needed help.
Do you see patients as a clinician as well now, or is that not taking place?
Only when they are referred to the blood center for a special treatment.
Oh,
But
what would be
I don't have a private practice.
Oh, I see. What would be some of the special treatments? What are you referring to?
We do therapeutic pheresis on people who have an excessive amount of platelets or white cells. We use the same machines that we would use to collect platelets from normal donors.
So you can
treat those
remove
patients.
things from people's blood if they had too much.
That's
that sort of
right,
thing. I see. Many people think that the blood that's taken out during a blood drive just sort of sits in a hospital and may not get used, and doesn't seem to be used for anything. But there really is a need for the blood. What actually happens when the blood leaves the blood drive? Where does it go? What happens with it next?
A lot happens. First, it has to be kept at the right temperature, and is transported to the blood center. There it is first analyzed for ABO type, in other words, to see whether it's A positive or negative or whatever.
The different blood types as we saw in the demonstration.
That's right. Then it is tested for atypical antibodies. It is also tested for hepatitis B and syphilis and other specialized testing.
So diseases are being looked for in this testing?
Yes. The bag itself is separated into different components. So from one single unit of blood, you can make a packed cell, a plasma, a platelet, and or a cryoprecipitate, which contains a clotting factor, the one used in hemophiliacs.
So these different parts of blood might be used for people who have bleeding problems, for people who have cancer, people who are in surgery, after accidents. There seems to be an endless list of things.
Correct. So every, it may be one part of a particular donation that doesn't get used, but every donation has something that is eventually utilized.
Right. There must be 5 or 6 at least different parts of things you use.
That's right.
People often ask if there's any risk to going into a blood drive and giving blood. Is there a risk there when you actually give the blood?
Any risk of donating blood will be very minimal, such as discomfort on the venipuncture side or an occasional bruise.
A little sting of the needle.
That's right.
About all. Right.
If people are fasting, they may feel dizzy. That's why we'd recommend that people do eat before donating blood.
And that's why we saw in our demonstration that they give donuts at the end, too, so that people have some sugar in the food afterwards. Very interesting. The news media has said a lot about AIDS, the disease that is affecting a lot of people. San Francisco area as an example. Is there any risk to getting AIDS donating blood?
Oh, no. There is no risk of getting anything from donating blood. We use disposable equipment that is used only once in each donor.
So really, people really should realize that it's clean, it's safe. There's nothing that can be given to them.
It's scientifically done, and again with disposable equipment that is sterile.
The other side to that question then is, after the blood is taken and then needs to be given to somebody, how are we sure that there's no AIDS in that blood that might be given to somebody later on?
Okay, donors, for the past 2 years, ever since AIDS came into the picture and evidence started to come up that it may be transmitted by blood, blood banks started screening donors for possible symptoms of AIDS and discouraging people in the high-risk categories from donating blood.
So a real careful history is taken then to really see what's going on.
Yes.
Besides the high-risk categories that are excluded, are there other people who cannot be donators, are not able to donate blood? Are there certain categories?
We have 2 types of people that will defer from donating blood. The first type will be those that we believe their own health may be jeopardized by the donation, such as people with heart disease or cancer. The second category will be people that we have reason to believe may transmit some disease, such as AIDS or hepatitis.
I see. And that takes place during the history?
During the medical interview.
Right. We've certainly been inundated in the media with words about artificial hearts, artificial organs, even artificial ears lately. Do you foresee an actual artificial blood being available?
No, I don't foresee that in our lifetime. The experimentation is going on right now with blood substitutes, that all they do is carry oxygen for a very limited amount of time. In fact, you have to transfuse this type of substance every 8 hours. The patient has to be hospitalized with 100% oxygen. It has a very limited use. Those substances do not provide clotting factors, do not provide platelets.
So an example might be if someone was in a major automobile accident and they were bleeding out all of their blood and they had to have something to carry oxygen to their brain, they might be given this experimental chemical just to let them get oxygen temporarily till they get to the hospital where they would get real human blood.
Yeah, that could be an application.
I see. Right. Do you actually buy blood from people?
No. Our blood center has never paid a donor since 1948 when we opened our doors. In fact, 95% of the blood that is donated in the United States today comes from volunteer donors.
That's very good, too, because you seem to get healthier people donating blood when it's done that way.
Correct. And also they're truthful about their history. They have no reason to lie.
There's no secondary gain there for the economic advantage. I see. That's right. What benefits do people derive from donating blood?
Well, I think there are several. You have the psychological, the satisfaction of helping somebody who is not as lucky as you are. You also get a mini physical when you come to the blood bank. We test your blood pressure, your pulse, your temperature, your hemoglobin, which is the amount of red cells you have on board. We test your blood for syphilis and hepatitis. Any abnormalities are reported to the donor.
Oh, that's good. They get that information back
That's
later
right.
on. It's a free health screening almost, isn't
That's
it?
right, a mini one, but still.
That's very nice. It really is. Dr. Fernando, I want to thank you for taking time out of your busy work schedule and traveling up here to Yuba City tonight for the Medical Explorer program. I'm sorry that we've run out of time already.
That's fine.
Tonight we've had the opportunity to see just how easy and safe it is to donate blood. The need for donors is obvious, and I hope that you'll be first in line at the next blood drive here in the Yuba City, Marysville area. There are 6 blood drives each year in our community. Please do give the gift of life and be a blood donor. I'd like to invite you to write to me at my dermatology and allergy offices in Yuba City with your suggestions for areas and people that you'd like to see on this program. The Medical Explorer program, as you know, is a public service program, and I really do want to hear from you with your comments and suggestions. Please write to me at the Skin and Allergy Center of Yuba City at 367 Del Norte Avenue, number 4, Yuba City. In my next program, the Medical Explorer will take you behind the scenes of more interesting frontiers of medical care practices in the Yuba City and Marysville area. Till next time, I'm Dr. Robert Peppercorn, your Medical Explorer. Thank you for joining us tonight, and have a good evening.